Bones, joints, and connective structures.
This is the skeletal system. Its major functions include providing structural support so that we can stand upright, protecting our vital organs from most traumas, and acting as the site for blood cell formation. The skeleton can be classified into two components, the axial skeleton and the appendicular skeleton. The axial skeleton contains the skull, ribs, and spinal column. It functions in protecting the vital organs of the body and allowing humans to remain upright. The appendicular skeleton contains all of the bones of the extremities, as well as the shoulder girdle and the pelvis. This allows for movement and the articulation of limbs. There are 5 segments of the spine. The cervical spine has 7 vertebrae, extending from the base of the skull to the base of the neck. The thoracic region has 12 vertebrae, 1 for each pair of ribs, and ends at the posterior aspect of the ribs. The lumbar region has 5 vertebrae, extending to the sacrum of the pelvis. The sacral region has 5 vertebrae that are fused together and are contained in the bowl of the pelvis. The coccyx is a single vertebrae at the very base of the spine. Connective structures. Ligaments, tendons, and cartilage are essential for the proper function of joints. Tendons connect muscles to bones, such as the Achilles tendon, and ligaments connect bone to bone, such as the ACL of the knee. Cartilage allows the bones to ride over each other during movement, with relatively little friction. They also act as shock absorbers between the bones and other surfaces. The 3 types of cartilage are hyaline, elastic, and fibrous.
Joints are the point of articulation between 2 bones, allowing movement in specific directions. Condyloid-epsiloid joints allow limited motion in 2 directions, such as in the C1 and C2 vertebrae connecting the head and neck. Saddle joints permit combinations of limited movements along parallel planes, such as where the thumb connects to the palm. Hinge joints allow for flexion and extension, such as in the fingers and elbow. Pivot joints can have a turning motion, such as in the ulna in the forearm during pronation and supination. Ball and socket joints have the widest range of motion. They are able to provide flexion, extension, abduction, adduction, and rotation, such as in the shoulder and the hips. Gliding plane joints are found in the tarsals and carpals of the foot and palm, and between each vertebrae. These joints allow the bones to glide past each other with a minimal amount of movement. Fractures are a break in the bone caused by forces that exceed the strength of the hard bone tissue. Most fractures are classified as traumatic fractures when an excessive external force travels through a healthy bone, such as during a fall off a bike. Another type of fracture is a pathologic fracture, when a weakened bone can fracture under a normal strain, such as lifting a mug of coffee. This is caused by underlying diseases or disorders, such as osteoporosis. Fractures can be closed or open. A closed fracture is a broken bone that remains inside the body and does not penetrate the skin. An open fracture penetrates the skin and exposes the deep tissues of the body to the exterior environment. This type of fracture has a high risk for infection. A displaced femur fracture can be a true medical emergency. Between 1,000 and 2,000 milliliters of blood can be lost in a unilateral break. Therefore, field stabilization using a traction splint is a necessary procedure. Traction splints immobilize the femur and provide continuous traction to keep the sharp bone ends in alignment. The indications for a traction splint are suspected mid-shaft femur fracture. The contraindications are if the injury is within 1 to 2 inches of the knee or ankle, if the knee, hip, or pelvis is injured, or if the broken femur is an open fracture. To apply a traction splint, first assess the distal PMS of both unaffected and affected legs. Stabilize the injured leg by applying manual traction. Then measure the splint on the uninjured leg and adjust the length accordingly. Position the splint under the injured leg until the ischial pad rests against the bony prominence of the buttocks. Once the splint is in position, raise the heel stand. Attach the ischial strap over the groin and thigh. Then secure the ankle strap with the patient's foot in an upright position. Attach the S hook to the D ring and apply mechanical traction, and continue to do so until it's equal with the manual traction and the pain and muscle spasm are reduced. Attach the leg support straps and then recheck the ischial strap and ankle hitch to ensure both are securely fastened. Finally, reassess the distal PMS.
Another type of trauma you might encounter is a dislocated shoulder. In this injury, a fall or blow causes the top of your arm to pop out of the shoulder socket. The shoulder is a ball and socket joint, which allows for a very wide range of motion. However, this means that the joint can be very unstable and prone to slipping out of place. In severe cases, a dislocated shoulder can cause tissue and nerve damage around the joint. Multiple shoulder dislocations could lead to chronic instability and weakness in the joint, so it is important to ask the patient if they have injured the area previously. With a dislocated shoulder, you can expect to see deformity in the upper arm, swelling and/or bruising, pain and tenderness in the shoulder, and the patient will most likely not be able to move the shoulder. As an EMT, you will need to splint the shoulder in the position found. Be sure to check the pulse, sensory, and motor function of the arm and hand during treatment. Transport the patient in a comfortable position, which may involve putting a pillow between the patient's arm and torso. Osteoarthritis is a medical condition most common in patients over the age of 65 and affects 27 million Americans. Osteoarthritis is a degenerative joint disease and occurs when the cartilage in a person's joints breaks down, thus reducing the cushioning between bones. This leads to pain, stiffness, and swelling in the joint. Patients often experience stiffness in the knees, hips, lower back, neck, fingers, and toes. OA can be genetic or caused by injury, overuse, or being overweight. As EMTs, we may need to secure a limb using a splint or treat other trauma from an injury, and quickly transport the patient for x-rays or further treatment. Other emergency treatment may be necessary if the patient has taken too much medication for their symptoms or has not been taking their prescribed medication.
Osteoporosis is another type of skeletal disease in which the bones of the body become more brittle and fragile due to the loss of osteon tissue. The disease commonly affects elderly women more than elderly men. As EMTs, we commonly do not treat osteoporosis, but patients with the disease are at a much higher risk for bone fractures even in simple falls, so it's important to factor it into the patient's disabilities and assessment. Bone tissue is highly vascularized, so while a fracture is at a high risk for bleeding, it is also a relatively quick healing tissue. Many fractures can be healed in 3 to 12 weeks. Cartilage, tendons, and ligaments, on the other hand, are mostly avascular with no rich blood supply, so healing is a very slow process. This is why tearing the ACL, or the anterior cruciate ligament of the knee, is a much more difficult injury to heal from than a broken arm.